Zocor tablets is used along with appropriate diet to help lower bad cholesterol and fats such as LDL, triglycerides, and raise good cholesterol (HDL) in the blood. It belongs to a group of drugs known as statins. It works by reducing the amount of cholesterol made by the liver. Active ingredients: simvastatin. Lowering bad cholesterol and triglycerides and raising good cholesterol decreases the risk of heart disease and helps prevent strokes and heart attacks. In addition to eating appropriate diet such as a low cholesterol, low fat diet, other lifestyle changes that may help this medication work better, including exercising, loss weight if overweight, and stopping smoking. Indications: related conditions: angina, cardiovascular disease, heart attack, stroke. How to use. Recommended dosing. The usual dosage range is 5 to 40 mg per day. In patients with CHD or at high risk of CHD, Zocor can be started simultaneously with diet. The recommended usual starting dose is 10 to 20 mg once a day in the evening. For patients at high risk for a CHD event due to existing CHD, diabetes, peripheral vessel disease, history of stroke or other cerebrovascular disease, the recommended starting dose is 40 mg per day. Lipid determination should be performed after 4 weeks of therapy and periodically thereafter. Restricted dosing for 80 mg. Due to the increased risk of myopathy, including rhabdomyolysis, particularly during the first year of treatment, use of the 80 mg dose of Zocor should be restricted to patients who have been taking simvastatin 80 mg chronically for 12 months or more without evidence of muscle toxicity. Patients who are currently tolerating the 80 mg dose of Zocor, who need to be initiating on an interacting drug that is contraindicated or is associated with a dose cap with simvastatin, should be switched to an alternative statin with less potential for the drug-drug interaction. Due to the increased risk of myopathy, including rhabdomyolysis, associated with the 80 mg dose of Zocor, patients unable to achieve their LDL-C goal utilizing the 40 mg dose of Zocor should be not titrated to the 80 mg dose, but should be placed on alternative LDL-C lowering treatments and provides greater LDL-C lowering. Co-administration with other drugs. Patients taking verapamil, diltiazem, or dorondiran. The dose of Zocor should not exceed 10 mg per day. Patients taking amiodarone, amlodipine, or ranolazine. The dose of Zocor should not exceed 20 mg per day. Patients with homozygous familial hypercholesterolemia, the recommended dosage is 40 mg per day in the evening. Zocor should be used as an adjunct to other lipid-lowering treatments in these patients or if such treatments are unavailable. Simvastatin exposure is approximately doubled with concomitant use of lometoprid. Therefore, the dose of Zocor should be reduced by 50% if initiating lometoprid. Zocor dosage should not exceed 20 mg per day or 40 mg per day for patients who have previously taken Zocor 80 mg per day chronically for 12 months or more without evidence of muscle toxicity while taking lometoprid. Adolescents 10 to 17 years of age with heterozygous familial hypercholesterolemia, the recommended usual starting dose is 10 mg once a day in the evening. The recommended dosing range is 10 to 40 mg per day. The maximum recommended dose is 40 mg per day. Dosage should be individualized according to the recommended goal of therapy. Adjustments should be made at intervals of 4 weeks or more. Patients with renal impairment. Because Zocor does not undergo significant renal excretion, modification of dosage should not be necessary in patients with mild to moderate renal impairment. However, caution should be exercised when Zocor is administered to patients with severe renal impairment. Such patients should be started at 5 mg per day and be closely monitored. Contraindications. Simvastatin is contraindicated in any patients with simvastatin hypersensitivity or hypersensitive to any component of the medication. Alcoholism, cholestasis, ethanol ingestion, hepatic decompensation, hepatic disease, hepatic encephalopathy, hepatitis, jaundice, electrolyte imbalance, endocrine disease, females, hypertension, hypothyroidism, infection, myopathy, organ transplant, renal disease, renal failure, renal impairment, rhabdomyolysis, seizure disorders, surgery, trauma. Precautions. Some medicines affect the way that simvastatin works and can increase the chances of you having serious side effects such as muscle damage. Tell a doctor pharmacist if you are taking any of the following medicines: antibiotics such as clarithromycin, rifampicin or fusidic acid, medicines used to treat fungal infections such as fluconazole or ketoconazole, some HIV medicines, medicines used to treat hepatitis C virus infection, warfarin, a medicine used to help prevent blood clots, cyclosporin, a medicine to treat psoriasis and rheumatoid arthritis, danazol, a medicine to treat endometriosis, amiodarone, a medicine that helps your heart rhythm get back to normal in atrial fibrillation, verapamil, diltiazem or amlodipine, medicines for high blood pressure and heart problems, colchicine, a medicine used to treat gout. Side effects. Serious side effects. It happens rarely, but less than 1 in 1000 people taking simvastatin may have a serious side effects. Stop taking simvastatin and call a doctor if you get unexplained muscle pain, tiredness, weakness or cramps. This is more likely if you are taking a high dose of simvastatin, and it can happen a few weeks or months after you first start taking this medicine. This can be signs of muscle breakdown and kidney damage. The whites of your eyes turn yellow, or your skin turns yellow, although this may be less obvious on brown or black skin. Or if you have pale poo and dark pee, this can be signs of liver problems. You get a skin rash with pink or red blotches, especially on the palms of your hands or soles of your feet. This could be a sign of the skin reaction, erythema multiforme. You have severe stomach pain. This can be a sign of acute pancreatitis. You have a cough, feel short of breath, and have lost weight. This can be a sign of lung disease.